A newborn is noted to have excessive salivation and difficulty swallowing immediately after birth. During the first feeding attempt, the infant chokes and becomes cyanotic, prompting urgent medical evaluation. The healthcare team attempts to pass a nasogastric tube, which fails to progress beyond 10 to 15 centimeters from the nas. A chest X-ray reveals the tube coiled in the upper esophagus and a gas-filled abdomen, suggesting a distal connection between the trachea and gastrointestinal tract. What is the most likely diagnosis for this infant? A. Tracheomalacia. B. H-type tracheoesophageal fistula. C. Esophageal atresia, EA, with tracheoesophageal fistula, TEF. D. Congenital esophageal stenosis. The correct answer is C. The infant's symptoms of choking, inability to pass a feeding tube beyond the upper esophagus, and the radiographic appearance of coiled tubing in the chest, combined with analysis of air in the stomach, suggest esophageal atresia, with a distal tracheoesophageal fistula, type C TEF EA, which is most common, where the upper esophagus ends in a blind pouch and the lower esophagus forms a fistula with the trachea. This condition is congenital and requires immediate surgical intervention to correct the anatomical defect and prevent complications such as aspiration pneumonia. This case highlights the critical nature of early diagnosis and management of EA with TEF, a congenital defect where prompt surgical intervention can significantly improve outcomes. Understanding the clinical presentation and appropriate diagnostic steps is crucial for healthcare providers. Early surgical repair involves separation of the trachea and esophagus and repair of the esophageal segments to restore normal feeding.